When America is mentioned, a couple of words come to mind: freedom, guns, and the worst healthcare in the developed world. Is that an exaggeration? Not really. In almost every global ranking, America is always dead last in almost every category, only coming on top of the other countries in the care process, and one other thing: cost.
He'll never be able to afford this room.
You're right, nurse.
America has the highest cost of healthcare per capita, with the average American paying more than $12,000, beating the rest of the world by a large margin, which contributes to over 18% of America's GDP in 2021, which is the highest in the world. But even when it costs an arm and a leg, ironically, the treatment provided isn't exactly the best. America has the highest avoidable deaths and infant mortality rates compared to other OECD countries. Not to mention the life expectancy difference of nearly 5 years compared to countries like the United Kingdom. So why is it that the leader of the free world doesn't have free healthcare? America has one of the most confusing and complicated healthcare systems in the world, and it looks something like this. To get a basic understanding of the American healthcare system, one would need to identify the funding, the insurance, the providers, and the pharmacy. Let's start with the public healthcare system. In the public system, the funding comes from the American government, or rather the taxpayer, which provides insurance programs such as Medicare, Medicaid, CHIP, and military healthcare insurance programs, which covers for their treatment of patients in public or private hospitals all across the US, which are supplied with medicine and equipment from pharmaceutical companies. In the private sector, however, funding comes from the individual citizens, either paying for their own medical insurance or employer-sponsored insurance from private insurance companies, or both. Similarly to public insurance, those under private insurance also receive treatment from hospitals, public or private, and receive their prescribed medicine from pharmaceutical companies. In hindsight, the American healthcare system doesn't seem too complicated, but everything comes with huge asterisks. Citizens who lose their job lose their employer-sponsored insurance. Medicare has 4 parts, parts A to D. The minimum income of eligibility for Medicaid differs from state to state. Insurance companies require prior authorizations before physicians can treat their patients. Co-pays, co-insurance, deductibles, etc. However, the biggest problem with the system is the cost. The 3 problem areas are private insurance, providers, and pharmacies. The short version of it is that private insurance will usually cover for their patients' medical expenses, but before doing that, they will negotiate with the providers, in this case hospitals, on what they will and will not cover, which results in the patient making some surprise out-of-pocket payments, or in some case, the insurance won't even cover the needed treatment or drug at all. This is further exacerbated by the fact that hospitals are not very transparent with the cost of the treatment they provide. It was reported in 2018, the cost of birth in the US could be around $10,800 or higher, which is among the highest in the world. Doubled with the fact that drug prices in America are ludicrously expensive. On average, Americans pay more than $1,000 for medications, almost 2.5 times higher than the OECD average of $571. The reason for this is because the American government doesn't regulate pharmaceutical companies, meaning that these companies are free to charge however much they want for the drugs that they create, thus causing situations like this.
This morning, stocks of several biotech companies are down. Investors are responding to the outrage over a 5,000% price increase for a life-saving medicine. One tablet of Daraprim used to cost $13.50. The drug maker recently increased the price to $750.
Why was it necessary to raise the price of Daraprim so drastically?
Well, it depends on how you define so drastically, because the drug was unprofitable at the former price. So any company selling it would be losing money.
The average cost of treatment for patients rose from about $1,130 to $63,000. For certain patients, the cost can run as high as $634,000.
This is the German healthcare system. Even though Germany has universal health coverage, it does share some similarities to the American healthcare system. Germany has 2 types of subsystems. I wouldn't even begin to try to pronounce this. Statutory health insurance, or SHI, and again, I will not pronounce this, or private health insurance, PHI. SHI is mandatory for all German citizens earning 5,550 euros per month, while PHI, however, is an optional alternative to SHI, keynote being optional, which is available to those who are earning more than 66,600 euros, are self-employed, unemployed, or over the age of 55 and unemployed. How SHI works is through a Krankenkasse, or sickness funds that then covers most of the medical expenses at hospitals or private general practices. PHI does pretty much the same thing, but rather than the funds going to sickness funds, the funding would go to private insurance companies that provide the same or better benefits as SHI with premium payments. Where the German and American healthcare system draw similarities is that SHI is tied to employment, which means, similarly to the private healthcare system in America, if a German employee loses their job, they then also lose their insurance. Even though Germany's healthcare system seems much less complicated and arguably better than the US healthcare system, it isn't without its faults. Medicine shortages, staff shortages, long wait times, among many things, plague the German healthcare system. So what can be learned from both of these systems? The key takeaway is that no healthcare system in the world is perfect. Every country is constantly learning on how to provide the best healthcare for its citizens within the system that it's in. America is no different. However, America somewhat puts itself in a cage when it comes to healthcare, and this is because the American healthcare system is for profit. Insurance companies refusing to pay for medical bills, hospitals having no cost transparency, medicine costs being too much for some to bear. Almost every aspect of the American healthcare system is for profit. So, is the American healthcare system broken? No. In fact, it's been working just as intended.